The next part of our program will feature presentations focusing on land use decisions and our health. First, we will hear from Dr. Philip Fine, the Assistant Deputy Executive Officer for Planning, Rural Development, and Area Sources at the South Coast AQMD. Thank you. In this role, Dr. Fine helps oversee the development of the agency's air quality management plan, as well as strategies for particulate matter controls, meteorology and forecasting, air quality evaluation, air toxics, risk assessment, and various rulemakings. Our second presenter, Dr. John Faust, is a senior toxicologist at the California Environmental Protection Agency's Office of Environmental Health Hazard Assessment in Oakland, California. Dr. Faust has managed the development of the California Community's Environmental Health Screening Tool, something I'm sure many of you are familiar with, as a means to consider the combined burden of environmental pollutants in public decision making. This work has included evaluating scientific data on health and exposure disparities and population vulnerability, especially in low-income or minority populations. Please join me in welcoming these accomplished speakers.
Thank you, everyone. Let me apologize in advance. I'm one of those Ds that Dr. Bullard was talking about, and not only am I another one of those Ds, I'm going to be talking about rocket science a little bit. But obviously, no matter how many Ds after my name, I'm not, can't be that smart to agree to speak after those last two speakers. And hopefully that 10-minute break was enough to have you forget how eloquent those speeches were. Okay, so what I'd like to talk about today is a little bit about some context and some of the challenges we face when it comes to exposure in some of the environmental justice communities. And I want to make one distinction as we go. We have several types of air quality problems in Southern California. And we can divide them into kind of two general categories. One I would call regional pollution. And these are the pollutants you've heard about today, like ozone and PM 2.5. And these are primarily formed in the atmosphere, not emitted from the types of factories and sources we talked about earlier. And what happens with these pollutants is they're emitted upwind, largely in the western side of the air basin, and then they travel over many, many miles and over the whole day. Go back one, sorry. Over the whole day, and then they impact disproportionately some of our inland areas in Riverside and San Bernardino County. So there is an environmental justice issue there, but it's not the proximity issue that I'm going to talk about for the rest of our talk. When we talk about proximity to, could be a roadway, could be a factory, we're talking about local pollution impacts. And we all know that whether you're 10 meters from one of these facilities or a roadway, or 100 meters or 1,000 meters, there's a very different type of exposure that happens on those spatial scales. So when we talk about air toxics, the one that we focus on the most, because it does drive cancer risk in Southern California, is diesel particulate matter, considered by the state, again, to be a carcinogen. But there's other toxic chemicals as well, such as benzene and metals, such as nickel and lead and cadmium, that we focus on in a lot of our work. And as part of that work, every few years we do what's known as a MATE study, or a multiple air toxics exposure study. And what we just completed last year, the MATES 4 study, which was the fourth installment over the past couple decades. And it was part of the Environmental Justice Initiative of the AQMD that you heard about earlier. And its purpose is multifold, but it's really to provide the public with information on their toxic exposure across the basin, evaluate our progress and other agencies' progress in reducing that toxic exposure and risk, and also providing us information of how we might focus our efforts in the future to really target those areas where we can do the most good. In this analysis, we don't include those regional pollutants like PM and ozone. We handle those through some other mechanisms in our air quality management plan and when we're complying with Clean Air Act requirements. So as part of the MATE study, we do measurements, and we measure at various locations throughout the basin, many of them in environmental justice communities. We also do a modeling exercise, which I'll talk about in a little bit, and we measure a wide range of pollutants, including here black carbon, which we use to measure diesel particulate matter. We also include ultrafine particles, which are even smaller than PM2.5 and have additional health effects, and a wide range of toxics that we know in urban areas are the ones that drive that toxic risk. So some of the results, and this is the results of the monitoring, you could see that when we average across all our monitoring stations, that the cancer risk in the basin is about 418 per million. Those are odds of getting cancer if you were exposed to these over a 70-year period. If we compare to what we did 7 years ago in the MATES-3 study, this is a huge improvement. The number back then was over 1,000 in a million, so that represents over a 65% reduction in toxic risk over a short 7-year period. The other thing we find in these studies is that the mobile sources, those sources that we at AQMD have very limited jurisdiction over, account for 90% of that risk overall. Obviously, there's some local hotspots related to stationary sources. And of that 90%, or of the total, almost 70% comes from diesel emissions, mostly from diesel trucks on the roadway or off-road equipment that has diesel engines. The other thing we do in the study is not only monitor pollution, but we can model it. We know where the emissions are coming from. We can put it in an air quality model, and we can predict for every 2 kilometer by 2 kilometer square throughout the entire basin what your cancer risk is estimated to be. So we can produce maps like this, and we have this on our website. So this is another kind of a tool, a screening tool that as we've heard about earlier. You can go on our website and zoom in to where you live and see what the cancer risk in that area is according to these estimations. Again, on a 2 kilometer by 2 kilometer scale. What I'm showing you here is actually what we did in MATES-3 back in about the 2005 timeframe. Now, if we use the same methods and look at 7 years later, the map looks like this. So it's got a lot cleaner, but you still see the port area popping up as a high risk area, and you see in both maps that the highest areas of risk hug our transportation corridors because of that diesel risk from trucks and other diesel engines. Now, there's one big caveat to these results, and that is the methods that we use to estimate risk are changing very soon, and they're being updated. And the net result of those those new guidelines of how to estimate risk, because they're considering early childhood exposure, updating our breathing rates that are in the models, and also the time you're at your residence or the time you're at your workplace. The net result of all that is that we have been previously underestimating risk by almost a factor of 3 for many, many years. So the net result is that when we do these new calculations, the map's going to look a lot like it did before. It does not change the fact that we have these huge improvements. People are being exposed to less toxics than they were before, but the estimation of the risks from being exposed to those levels of toxics is going to be higher. So these guidelines are going to be finalized very soon. If we do look at the map again, under these new guidelines, as I mentioned, it looks a lot like that map from 7 years ago. So what this tells us is that a lot of progress has been made, but we have a lot further to go to get these risks down to levels that are not so high and not some of the highest in the nation. Now, I talked about those modeling exercises. We can go down to a 2 kilometer by 2 kilometer square throughout our entire area. But as I mentioned earlier, and all of you know, if you're 10 meters from a roadway or 100 meters from a roadway or 500 meters from a roadway, that makes a big difference. So what those maps can't capture is that very, very fine spatial scale, even though 2 kilometers by 2 kilometers is finer than usually is estimated anywhere else in the country. So when we talk about those finer scale exposures, it can be a roadway, it can be a facility, it could be a factory, a refinery. Well, I'm going to use the example of near roadway just as an illustration. So you could see here, as we heard earlier, that there are still buildings being built, apartment buildings being built in areas that are extremely close to roadways, like you see in the upper right here. And in the lower left, you see Hudson Elementary, where we still have a very, very busy Terminal Island freeway with trucks, huge number of diesel trucks right next to their playground. So these issues are very important. When we look at the health evidence of living next to a busy roadway, regardless of what pollutant is causing it, just by virtue of living next to a busy roadway, all these different health effects have been found, whether it's asthma or lung function, cardiac effects. All the studies show that just by virtue of living next to a roadway. Now, it's not known exactly which pollutant is causing it. There are some hypotheses, but it is coming from traffic pollution. See. So in Southern California, obviously this near roadway issue is a big issue. This is our freeway network, and if you the blue wide lines are a 1 mile buffer around our freeway network. And if you look at the maps, if you look at the GIS data, about 50%, over 50% of our population lives within 1 mile of one of these freeways, and that does not include the other roadways that could be very busy, almost as busy as some of the freeways that even go through some of the communities. When we look at the data of what these roadway exposures are, and this is seminal work done at UCLA several years ago, is that those high exposures occur very close to the roadway. They drop off relatively fast. In this case, in this season, about 100 meters away. But you could see a 5-fold or 10-fold increase in some of the pollutants such as carbon monoxide, diesel PM, as well as particle number, ultrafine particles. You don't see as big effect in things like PM 2.5 because, as I mentioned earlier, that's more of a regional problem. Now, if you do that same study at a different time of day, early in the morning when the winds are different, meteorology is different, that impact zone expands out to over a mile. So sometimes of the day you get a very narrow exposure window. Other times of the day it can go out much, much further. So it's not just those living very close to the freeway. It can be even further from that. Now, there's some things we can do about this, and by far the best thing we can do is reduce the emissions on the roadway, reduce the emissions from the tailpipe. That's because not only do you have those benefits of those people living near the roadway, you also have benefits for regional air quality, you also have benefits for climate. Sorry, can you go back one? You have benefits for climate as well as a myriad of other benefits. But short of that, and we're all working towards that as hard as we can, there's other things that you can do that have to do with land use decisions, such as buffer zones. If you're going to have a freeway and it has a buffer zone, maybe you shouldn't be infilling that area with schools or residences because they're going to have higher impacts. There's other things you can do on the roadway, such as lowering the number of cars or having the cars move more smoothly, so you can lower those traffic density and congestion problems. For railways, because we have the same issue if you're living next to a busy rail yard or a rail line, there's technologies out there like electrification of rail that they use for cargo and many other parts of the world that would minimize or almost eliminate some of those near-road emissions. We've done some work with indoor particle filtration. So when you do have an existing school in one of these situations, there is technology that can be put into those schools to protect the kids, at least when they're inside, from those very harmful ultrafine particles and diesel particulates that have those high health risks. And then there's been some other work on whether there's other mitigation measures, such as a sound wall or a tree line or other types of more novel active measures to just help disperse the pollution. It's still an active area of research, and it's not as simple as putting a wall there, but it's something that we're looking at very closely. So with that, I'll conclude and turn it over to my co-speaker. Thank you.
All right, good afternoon. So my presentation is going to focus on an overview of the most recent version of the California Communities Environmental Health Screening Tool, or CALENVIROSCREEN. We released the tool in October of last year. So if I could have the first slide. So the screening tool was developed by my office, the Office of Environmental Health Hazard Assessment, in conjunction with the California EPA. And it's the product of several years of work that stems originally from the Cal EPA's Environmental Justice Action Plan that committed to trying to understand the issue of cumulative impacts and think about ways to address them. It essentially reflects the need to confront the reality that communities across California face multiple burdens of pollution, and that decision-making within the agency should reflect this reality. The tool is the first step in identifying places across the state that bear high burdens of pollution and with populations that are particularly vulnerable to those pollutant effects. The tool itself is comprised of 19 individual indicators reflecting different types of pollution and different types of vulnerability, and it describes conditions across the entire state. So what I'm going to do today is, as I said, give a quick overview of the screening tool, talk about how it's designed, how information can be accessed, and a little bit about how it's used. So the process that brought us here started more than 15 years ago with environmental justice statutes, and since that time has had extensive public processes around it. We have had an environmental justice advisory group that provided us input and initiated the process. We've had a stakeholder work group devoted specifically to the topic of cumulative impacts and precautionary approaches, and since that time have had numerous workshops soliciting public input, particularly from people in communities that are thought to bear high burdens of pollution. The CALENVIROSCREEN tool was finalized in October of last year. So here's the overview of the model itself. So a screening tool is a way of looking broadly across the state at relative burdens from environmental pollution. It's not an in-depth analysis that could be used to predict health risks to an individual or to a group from a specific source, but it's a way to focus attention on places that may be needing additional attention. The overall model is here. It's broken into 4 broad categories, those related to pollution and those related to population characteristics. So when we think about exposures, we think about the ways that people come in contact with pollution. And then we also think about these environmental effects. These are conditions of environmental degradation or adverse environmental conditions that exist in different communities, like the cleanup sites and the presence of hazards. On the population side, in the model, we think about sensitive populations, people with physiological reasons, the special sensitivity of children, or people with existing health conditions. And now we're thinking also about socioeconomic factors and how socioeconomic vulnerability feeds into our concerns that certain populations may be facing worse health outcomes because of exposures to pollutants because of that reason. So the 19 indicators that are included in the model are shown on this slide. They reflect different measures of air and water quality, conditions of environmental degradation. There are certain measures, locations of cleanup sites, presence of hazards. We have some health measures as well as socioeconomic factors that are included. When we think about the criteria to include these individual indicators in our tool, we wanted indicators that represented widespread environmental concerns across the state, so that was an important consideration. And we also wanted to be thinking about measures that reflected different types of vulnerability, as I said. We had data requirements as well. Because we're trying to develop a statewide screening tool, we wanted information that was available across the state so we could make comparisons. And of course, we had data quality requirements. We wanted the data to be as current as possible, to be of good quality, and as accurate as possible. So I just include this slide just to underscore that CALENVIROSCREEN relies on data from a number of different sources. And to be clear, we did not collect new data, but we took raw data from many different places. A lot of it came from other boards and departments within the Cal EPA. It comes from federal data sources like the U.S. Census and U.S. EPA, as well as some of our other agencies within California, the Department of Public Health and the California Environmental Health Tracking Program. So what our tool does is bring together these data in one place so that it can be accessed, and we also combine the information together to start identifying these places that bear these high burdens. So the tool itself uses a relative scoring system. So the measures are not benchmarks of harm, but are based on comparisons of measures in one tract compared to other places across the state. And I probably should have mentioned that this analysis is done at the census tract scale. There are about 8,000 census tracts across the state. So the way we represent data in the tool is by calculating percentiles. So for example, if if a census tract is scored for ozone as a 75th percentile, it means that the level of ozone in that tract is estimated to be higher than 75% of the other census tracts across the state. We then combine all the information together to calculate an overall CALENVIROSCREEN score. And then while the CALENVIROSCREEN score itself isn't particularly meaningful, it allows us to make comparisons across the state to see where places might be rising to the surface in terms of higher burdens. So I've included a couple of examples of individual indicators. I won't go through all 19. But here's one, for example, for traffic density, one of the measures of potential exposures. And all of this information describing, why we would include this information and how we treat the data and where we access it is all available in our written report. But traffic data from Caltrans was obtained through the Highway Performance Monitoring System. We used estimates of traffic density that take into account both traffic volume as well as road length. We looked at estimates within 150 meters of census tracts to come up with our estimates for each tract's traffic density measure. The map for the greater LA area looks much, I think, like most of you would expect. We saw the roadway map in the previous presentation, and what you see are high scores along the known transportation corridors through the greater Los Angeles area, predominantly through the freeways. So this is one of the indicators that's included. Another indicator, cleanup sites. So here we're relying on information from CalEPA's Department of Toxic Substances Control. These cleanups are sites that are either undergoing evaluation or in the process of being cleaned up, sites where hazardous substances may be present and where potential exposures could occur. The raw data here are site locations, which are available through the EnviroStore database. For this analysis, we took into account the different types of sites as well as their status. And in the most recent version, we also took into account how close they were to where anybody lived. So for each census tract, it's essentially a sum of all the sites that are within it that we add up. So again, for the Los Angeles area, this is what we see for the score for this individual indicator for cleanups. You see high levels along certain corridors, sort of leading from the port area in the south through the central parts of Los Angeles, South Central, and corridors extending in different directions. For the purpose of illustrating this, we also included on this slide green dots representing the individual cleanup sites across the region. So you do see that there are certain areas that are very highly densely impacted by this. So the overall CALENVIROSCREEN score is calculated by combining all this information together, taking each of these percentiles for all these 19 individual indicators and bringing it all together. And this shows the overall CALENVIROSCREEN score results across the whole state. One observation is that we had relatively high representation of community census tracts in the greater Los Angeles area, as well as the San Joaquin Valley, where there were a high number of highly scoring tracts. This shows the map of the greater LA area again, and you see many of the areas extending from the ports in the south through the central and south central parts of the city, extending into San Fernando Valley, and then many highly scoring tracts extending eastward into the San Bernardino and Riverside areas. So we make information available in a number of different ways. We try to be as clear and transparent as possible in what we've done. We have a report that describes each of the individual indicators across the entire state, why we've included it, where we obtain the data, how we do our calculation. We also have a mapping tool. The way you saw it on the previous slide is one representation of what that essentially looks like, but it allows you to look for a specific address and identify the census tract associated with it, and see the scores for each of the individual indicators as well as the combined score so that you can also put it in the context of the entire state and how it relates to other places nearby or distant. We also make the data available in a more raw form. We have spreadsheets which allow you to look at the data in more detail with an Excel spreadsheet. We also have a Google Earth file as well as an ArcGIS database that allows those who are interested in doing even more sophisticated geographic analysis make that possible. So having the data available also allows us to do different types of analysis to look for trends and patterns in exposures and different types of measures. Here, what I'm showing is how each individual indicator in the exposure category relates to race, ethnicity. So each individual line is an individual indicator in the exposure category. And as you move from left to right across the screen, that's the percent non-white population in the tracks as you increase in exposure. And what you see are generally positive trends with higher non-white populations in the most exposed parts of the state. And that's particularly true for PM 2.5 toxic releases and diesel particulate emissions especially. We also can look at environmental conditions. This is the same chart showing like where the cleanup sites are, where the solid waste facilities are across the state, hazardous waste processing facilities and so forth. And while the trends aren't quite as stark, there are still some increases. So when you think about it, each of these individually, if you're looking particularly at the right side of the chart, these are the highest exposures in each of these categories, or the worst conditions. And we know that those don't necessarily have to be occurring in the same place, but in reality, those often do occur in the same place. So we also look at this information combined, and this next slide presents it in a slightly different way, but these are the combined pollution scores and the racial ethnic breakdown of each 10% group from lowest to highest. And then you see some very, very striking patterns. As the overall cumulative pollution goes up, the percent non-white population also goes up, with Latino and African American populations in the state particularly showing striking patterns. And this becomes even more prominent when you include the socioeconomic factors as well as the population sensitivity factors. This slide shows the overall CALENVIROSCREEN score and how it varies with race. Race itself is not an individual indicator in the CALENVIROSCREEN, but we're committed to continuing to evaluate the relationship between race and the CALENVIROSCREEN scores. So just a few words about the use of the tool. We heard mentioned before of SB 535 and the obligation regarding how the funds from the Greenhouse Gas Reduction Fund are spent as allocated in the investment plan. It specifies that greater than 10% of the funds be spent in so-called disadvantaged communities, and that more than 25% go to the benefit of those communities. The statute requires that disadvantaged communities be identified by different criteria, including geographic, socioeconomic, public health, and environmental hazard criteria, and that designation is made by the California EPA. So last year, the Cal EPA identified those communities using the CALENVIROSCREEN scores, highest 25% to identify those as disadvantaged. So here for the LA area, the highest 25% scoring census tracts are represented on this slide, and it's very similar to the pattern that you saw in the overall score slide before. So CALENVIROSCREEN, of course, is ongoing uses within the California EPA. It's already been applied in the Environmental Justice Small Grant Program as well, and the Environmental Justice Compliance and Enforcement Working Group. We also have an ongoing effort to ensure that staff of the different departments who need to make use of local information are acquainted with the tool and know how to access the information and how to understand its content to help them make better informed decisions locally. So that is all I have for now for CALENVIROSCREEN. I was asked to mention one other thing regarding the recent update to the risk assessment guidelines. OEHHA, my office, has responsibility for maintaining guidelines under the Air Toxics Hotspots program. There's been a multi-year effort to update these guidelines, and they brought these revisions to the scientific review panel in the fall of last year. Those changes are being finalized, and the guidelines are expected to be released in their updated form next week, which is, I guess, March 6th. So the guidelines are going to be incorporating particular consideration of the sensitivity of children. We've updated the guidelines to reflect these in the application of age sensitivity factors for the calculation of cancer potencies and cancer risks. And there's also been some changes regarding the breathing rates and exposure as well. So you can look for those next week and expect to be able to have that available. All right, so that concludes